So what the value program is a good question. It is a longitudinal integrated clerkship. So what this means is 10 medical students in their third year come to the VA and they stay with us for an entire 10 months and they do clerkship simultaneously.
And instead of doing little bits of information here and there, they're doing the rotation all at once, getting a panel of patients that they can follow and call their own, and trying to learn all about the different aspects of medicine all at one time.
It's also very independent, and you can decide what you want to do on a given day during your free time if you have no patients in, so that's very nice.
They were supposed to add 30 to 50 patients to their panels, but interestingly they started adding a lot more. So we have seen their panel sizes grow, and when I questioned that, I said, is this too much, too many patients? They're like, no, they're very interesting patients. Veterans are wonderful. We really would like to appreciate the opportunity to follow them longitudinally.
I literally go up to a staff physician and ask, like, could I work with you in clinic or could I see patients with you in the hospital? And they've all been totally receptive to that. I'm there fairly often. We kind of have our own clinic flow now. And she lets me really be involved with what we're deciding what we'll do for the patient.
Tell these patients that, hey, yeah, you're going to see me all over the place whenever you come here. And sometimes they'd say, oh, okay, that's kind of weird, or sometimes they'd say, this is cool, and sometimes they wouldn't care. But I think having seen them numerous times, they like seeing us.
It's fun when one of my colleagues has a question about a patient with congestive heart failure, and we can all kind of bounce ideas off of each other and correct each other, and I like that sort of organic learning process.
We've been able to really integrate ourselves here into the VA to the point that I feel like I know the VA system well enough to actually be a useful team member.
And with all of these other rotations that a lot of my other medical school counterparts are taking, they're going to be with the person for a week, 2 weeks, maybe 6 weeks top. But here we have 10 months to spend with these people. So we get to know their quirks, get to know their preferences, and just get to pick their brain.
And you have a designated set of faculty that are very invested in providing you an educational opportunity and giving you the best educational opportunity that they can, because they know that you're only getting exposure at this one site. They're going to get to know you. They're going to take a vested interest in what you want to learn.
I think value has really solidified my career goals. I still would like to do general surgery. I find that a lot of my preceptors, knowing my interests, they will try and make the learning points relevant. We research stuff together and then we talk about it every day after clinic. And he tries to base things on stuff that will affect my career in the future. So for example, recently we spent a bunch of time looking up the indications for people that come with primary hyperparathyroidism. So you see that in clinic a lot, and then when to refer to surgeons, and what's the best way to handle it.
You work with so many different providers all the time that you can kind of cherry pick what you want to incorporate in your own practice. So, I really like the way this provider talks with patients or parts of the physical exam, stuff like that.
Something I strongly consider when applying to Value, having 2 kids and a wife, having the stability of being at the VA every day was really, really helpful.
It definitely makes you more confident being in the same place, meeting the same people. You get your routine down, you can just focus on learning medicine.
I personally love routine and I love familiarity, and sounds really weird and cliche, but I feel like the VA has become my home almost. I'm here at least 5 days a week. I know my way around, I know all the shortcuts. The lady in the cafeteria who makes the sandwiches has memorized my order. Silly stuff like that, but it actually I think it's made a big difference in terms of how happy I am as a person.
The autonomy that they give us, the ability to focus where we want to, and the ability to follow these patients longitudinally and be with preceptors longitudinally. I thought that this program was, oh no, I can't say that. I was going to say invaluable.
I loved it. I loved it.
It was easy to make friends with the other 9 med students in the cohort. Easy, but I was really grateful for their support throughout the 10 months, and we became really good friends.
I think it was one of the best decisions I've ever made. I'm so happy I did it. My education has been fantastic in terms of medical knowledge and clinical practice. I also think that I've learned about patient care and the patient-provider relationship in a way that I never would have learned in medical school. Going to so many clinic appointments with patients and really kind of seeing things more from their perspective has been invaluable.